All right, this has been an awesome journey. I hope you have loved this course. A lot of awesome skill sets if you take this seriously and implement it well. And now it's time to bring all of this together on the child or that teenage patient. And now let's look at this and let's bring it all together, all right? It starts with what, right? Remember PCE, positive connotation. It starts with that is a great question, right? That we get asked a lot, consensus. Now the harder part is I am proud to work for the top Invisalign doctor in the area. Invisalign has even awarded her top 1% provider for treating thousands of cases successfully across the nation, okay? Now remember, if this is not an Invisalign inquiry, we're not gonna say this. We're gonna edify around braces, or we're gonna edify around the clinical work of some other type of price inquiry. How much do you charge for a crown? Things like that, okay? But we got to be really good at this. The other piece, remember, that you need to work on is what are your edification bullet points? Remember me bringing that up. Because if you're not top 1% and you're not the top Invisalign doctor in the area, you're not going to lie to them, all right? So there's still a way to edify your greatness while telling the truth. We need to make sure to edify, we need to educate, and do so ethically, okay? So I can properly answer your question, please allow me to ask you a few important questions. Is the patient an adult, teenager, or child? Okay, we're identifying our patient, right? This continues on now, and thanks so much. And can you please tell me, because remember, for this example, they answered it teenager or child. So now we're moving on to clinical confusion. Thanks so much. And can you please tell me what type of malocclusion classification the teenager has? All right, there's your clinical confusion, your education, which is then going to allow you to be set up to do what you see on the screen. Like I said earlier, that is a critical piece of information in order to provide the exceptional clinical care Dr. Olson is so well known for. See, many practices, look, it's a one-size-fits-all. They're just throwing prices out, and this approach will end up causing you to pay a lot more money later to get things fixed, okay? It's not a personalized approach. Here you can have the peace of mind knowing everything's personalized, right? From our clinical care to the patient experience to everything we do. It's personalized with utmost attention to detail. We use the finest clinical materials, and supplies, and everything we do is top notch. And that is why our doctor is renowned across the country for providing the best care that lasts a lifetime. All right, in addition, Susie, our treatment coordinator, will work with you to get the lowest monthly investment that fits your budget. She's amazing. Our patients adore her, and I've seen her help families get their payments as low as $129 a month. I'm confident she's going to help you too and find something for your budget. You're going to love it here. I want to be the first to welcome you into our family, and then we're going to close the deal. We have this Tuesday or Thursday available. Which would you prefer? Guys, I had a blast with you, all right? And I want you now, I'm going to leave this up on the screen, and I really want you to concentrate on this, role play this, and see how good you can get to eventually not even having to look at it. That should be your goal. This is scripting you can print out, you can put by the phones, and you can just start this right away. Don't worry about being great. Look, a lot of people are worried about, hey, I'm not ready to implement it or we're not there yet. Just do it, okay? Just do it. Make fast, quick decisions, implement fast. If you mess it up, it's okay. It's not a big deal. That's how you learn from it and get better, okay? So don't take it too seriously. Had an absolute blast. Pause me now. Go ahead and role play this as many times as you can. Everybody around the room. I hope you had a great time going through this course. We'll see you back here soon. Bye-bye.